Hi, this is Carlos St. Just, licensed acupuncturist, holistic healthcare provider. Fortunately, you can see my reflection here on my glasses because I'm looking at my screen. Let me see if I can maybe position this in a way so you can see me. Hi, how's it going? I can see my reflection. It's okay. So, hi. I just wanted to give a brief introduction. My name is Carlos St. Just, licensed acupuncturist, holistic healthcare provider. Maybe I should be using that light in order to provide coverage. I don't really need these goggles. These are, I think they're glasses, but they're stoggles, right? Thank you to my lovely wife, and wanted to raise those up here so you get less of a glare here. Straighten those out so we can keep proper. So it's been a bit of a long day for me, but I wanted to speak briefly about providing acupuncture at a time when there's a pandemic going on. Right? As you may be well aware of, there is a virus that has unfortunately taken a toll on many lives across the world. It's known as the coronavirus, COVID 19 for short. Today, to date this, there was the first, I want to say, successful vaccination of an individual in the United Kingdom, a 90-year-old female patient. And at the look of things, she looked like she was smiling. And so, and she was, to my knowledge. So I wanted to bring up the issue. For some reason, my screen turned red here. Hopefully, it doesn't. We'll see. I wanted to bring up the issue of what is it like treating during the pandemic, right? Providing acupuncture care amidst this virus and give you my personal experience and let you know, and my personal take, let you know that I am going to be taking the vaccine. Yes, I will be taking the vaccine. And I have my reason, obviously, one being the vaccine works and it has been shown in the studies to have minimal side effects. And I'm trying to recall the Pfizer study. Now, this is the Pfizer vaccine, which there was about 40,000 patients involved in the study. So that's a good number of patients. And I think we're putting a little bit too much into this. The studies have shown that the vaccine is good and it's safe and it's effective. I don't believe people should just, obviously, it's your body. You have the right to do what you want with your body. However, in the sense of, like, I think you have to really consider things in the sense of public care when it's not just yourself and weighing out these options. Obviously there's going to be people who don't react well to the vaccine. That's with every vaccine. But I'm going to take my colleagues' word on this. I'm going to take the research word on this and their suggestions. As an acupuncturist, as a licensed acupuncturist, I'll let you in on a little secret. I can't treat everything. As much as we would like to, and as great as the medicine is, as well as many conditions we do treat, we don't. There are certain conditions that I don't treat. If someone needs any kind of surgery, I'm not a surgeon. If I, when it comes down to bacterial infections, I refer patients out for antibiotics. In my opinion, antibiotics work very well. As far as antivirals, that's another story, right? And yes, obviously there are many that are very effective, but depending on the cold and the situation and the illness and things like that, I, you know, so there are conditions in which I will refer out. If I need imaging, for instance, we will refer out. So it's a matter of putting everything together. I am a holistic healthcare practitioner we all have different scales and levels in terms of our uniqueness, our involvement in terms of, and our skill level. And yeah, I do say skill level, but it's not about that, right? In this holistic field, right? It's more what's best for the patient, and everybody can have a different angle, right? And you know, the people I if you love what you do, your skill will grow. Okay, if you love what you do, your skill will grow. So providing treatment during the pandemic, I've followed all the rules in terms of wearing a mask and making sure that I have the proper eye protection and the rest of the PPE and cleaning and sanitization. But I've also implemented some other techniques in order to make sure things are safe, including air filters and uh, special sprays that I've created, in which I'm going to be getting tested to see if they are effective. I just wanted to switch the background here. But as far as providing acupuncture, you might say, well, doing acupuncture during a pandemic, what is that going to do? Hey, what are you talking about? There's a lot of things. First off, I wish the research was more available or being looked at in terms of the therapeutics, potential therapeutics, and sorry, someone sent me a text message here of traditional Chinese medicine and different herbs that I've seen around the world here. And my background is primarily in traditional Chinese medicine, so those are the only herbs that I know that I can prescribe safely through that system of medicine. And so going back to, yes, I wish there were things that we can do, but yeah, as far as what I wanted to convey is that people are going to need treatment. And trust me, not of course not everyone is getting sick from COVID or dying from COVID or COVID's the only diagnosis that's on the ICD-10 list to select. No, that's not the case. As I'll tell you, working in my practice and other multidisciplinary clinics, that people are coming in for many different ailments, and I say it's a continuation of what we've always been doing, which is always improving patients' health outcomes despite what we have going on. And throughout this pandemic, I've been lucky enough to test negative, at least for every test that I've taken, and I haven't had any issues in terms of symptoms or I have been in the environment when there was an outbreak in one clinic um, that I was practicing in, but being tested multiple times after that and ensuring that I didn't get infected, I was trying to follow all these protocols as much as possible, right, to the T, to help patients to make sure and ensure that patients are receiving the care that they deserve, the care that they need. So I'm hungry. It's been a long day. It was a great day. Patients are feeling better. I'm feeling more confident in myself in terms of the direction I want to take things, in terms of being able to provide the best care and being able to explain what is going on, being able to explain to the patient so that they can understand as much as they can at that moment, and then maybe it will lead to them learning more, right? So low battery. Okay, so I'm going to end it here. And if you have any questions, please feel free to send me an email, mailbox at csjacupuncture.com. You can also, don't forget to smash that like button and let the whole world know that we are here, and it will help other people find this group, right? Video. our community. And besides that, oh, and don't forget to subscribe. This is Carlos St. Just, licensed acupuncturist, holistic healthcare provider. Always helping you out, always here to help. Peace.